It says oxytocin or pitocin. It's a synthetic drug that exerts the same physiological effects as the posterior pituitary hormone. Thus, it promotes uterine contractility and is used clinically to induce labor.
There you go. So before you jump and say you're going to do what? Cesarean section, you're going to try to use a what?
Okay, to pitocin.
To get
Oxytocin.
You guys are with me?
Mm-hmm.
And you don't just say, okay, you have to see the reason why you're going to have to use a pitocin.
Mm-hmm.
There's something going on. Why the woman cannot get, or why she's not dilating. Right? Why that cervix is not getting right. Why are we not getting that dilation? Right?
Mm-hmm.
I gave you another drug yesterday. Argometrin. Listen. I gave you argometrin yesterday. Pitocin, oxytocin, argometrin. We're looking at uterine contractors. The uterus contracts.
Mm-hmm.
And why you need the uterine to contract?
To induce
So
labor.
you can push the baby out. Childbirth is a natural something. All right? The baby don't be what? Trying to climb out. Baby's just lying in there. But your contraction. You know, when, for all you ladies who went to what? The clinic, right? And they teach you how to breathe. When the contraction occurs, with each contraction they tell you what? Hold the breath for what? 10 seconds? No?
Yeah, she will hold the breath.
Miss Thomas?
But you need to.
Argomotrium.
Then he give the answer. I only have the
Pitocin. Pitocin is oxytocin, the same thing.
I didn't have nothing. I didn't have time to get nothing when I gave birth to both my kids. I work with my son. I was in school. My kids had no taxi. And my daughter, I almost have her now. Almost have her in the car. But my husband, my ex-husband, was so slow. So when I told him I was in labor, he panicked. He didn't even know what to take, what to do. And I was ready to, I was about to push that baby out and bring him down. In the hospital, when I was going, the cop stopped me because he was driving so fast. And then when he was about to ask for driver's license and everything, he saw me. He said, "Follow me."
The cop, right?
And he had called everything. So when I got there, everybody was.
How long is it to? Sorry, go ahead.
I went in and out. Like I couldn't wait for my doctor. Yeah, my kids come out fast. That's why I don't want to get pregnant no more.
All right, guys, let's not please. We have Mr. Bose is outside there, and he's been waiting for persons. Stanley spoke to you guys yesterday, right? And for persons who need to do your payments, please see Bose so that we can continue the classes, or as we can't continue the classes. We can only continue the people who are paid. All right, so Anybody who need to go see Mr. Bowes or talk to Mr. Bowes, please go talk to him. Mr. Bowes, you wanna check with them, please?
So let me start by, let me see. 1, 2, 3, 4, 5, 6, 7, 8. Let me start by 1, 2, 3, 4, 5, 6.
Can you remember the two we talked about? We did marasmus babies, or the marasmic baby.
Kwashiorkor.
Kwashiorkor, right? And all is based on not getting enough food. But like the kwashiorkor, it has a lot to do with proteins. Please make those connections between your nutrition and these pediatric situations. Now the mother who is going to get this baby, they want to weigh the mother the time she's pregnant. To see if the mother is an underweight mother, if the mother is an overweight mother, or the mother is normal weight. And what we talk about normal, overweight, and underweight is based on the BMI, the body mass index. Height and weight. And they have the numbers. Average, and why we talk with the numbers, is that within that, is it said 9 months? Or we said 40 to 9 to 40 weeks?
40 weeks.
How many pounds should an underweight woman put on? That's what we're talking about. How many pounds should a woman who is overweight put on without putting that person into the risk category? And you will find that an average weight gain is approximately 25 pounds. Average weight gain is approximately 25
pounds.
But for each one of those categories, they have different, like the underweight person, they want to put on more weight. Not 25 pounds, but much more weight because why? They're already underweight, so they go as much as up to 40 pounds. Because they're putting on weight, because they're what? Underweight. The normal is going to be about 25. The overweight, they're going to be 25, but not too much. Because one of the things that women who are overweight is delivery. And that end up having what?
Cesarean.
C-section, right? And we have to take a lot of different things into consideration as you get more into it, like why a person getting episiotomy, right? What is a different presentation? Where's the presentation by shoulder presentation, buttock presentation, and these presentations are called breech. Breech
presentation.
Are you guys with me?
Yes, sir.
Now the baby coming out. It's just this basically. Basically, the baby should come out how? That's them we're talking about.
Head
This is what we
first.
say.
Head
Not just
first.
the head first. How? All right.
Coming out first.
No, not the foot.
It should be. Guys, stay with me and listen very carefully.
The compounds?
Occipital presentation.
Okay.
The back of the head. Color with the
Occipital.
forehead can be a problem. Shoulder presentation.
Occipital presentation.
Butt presentation. Be a problem. Come with the legs out. Can be a problem. The normal presentation is a occipital, not the head, the occipital, not just at the head. Guys, look at presentation, fetal presentation.
How you spell occipital? Occipital.
OCCIPAL.
Presentation. Okay. Thank you.
Fetal presentation.
Look at types of presentation. Look at the different type of presentation. Oh my God. UPIS.
Yeah, fetal presentation.
IOTOMY. PCRT.
Look. Fetal
But don't
presentation.
look at the PCRT right now. Why do you look at presentations?
Fetal presentation.
Fetal presentations.
Delivery.
Here.
Guys, they'll give you a whole lineup of them. Can you see the lineup?
Mm-hmm. You alright, sir?
Man, my own saliva nearly killed me. All right. That's HP. So somebody read the first presentation. Anyone that you have as number one. What's normal presentation? What's in?
Normal.
Oh, I didn't see for me last one. Thank you.
Normally, the position of the fetus is facing toward the woman back. If it was normal with the face and body angled to one side
Bridge
and the neck
presentation.
flexed.
Complete bridge.
All right, look at the bridge presentations. Is what? With the bridge presentation, what's coming out first? Look at it, man. Come on, look at the image. What's coming out first? I would like to go through, but
The head.
I know why this thing is going.
Breech presentation. The back of the head. Mm-hmm. Here it is.
Sometimes the food is coming out some different ways.
You guys just look at the diagram that has all the presentations in front of you. You honestly, one of the worst you can get is a shoulder presentation. That is very, very difficult for the baby to come out. Having the butt presentation is another difficult presentation.
That can cause meconium. This too. In the meconium in
The board is
Look at the forehead
amniotic fluid.
presentation.
which? Which?
Right to bleed, right occipital, transverse. Wait, this is all occipital. Occipital.
Occipital.
I don't know why these women are looking at it. I'm gay. You guys had these babies. And y'all must see what come out. You know, see the come you guys.
I have normal. Full delivery. Full delivery.
Look at the normal presentation first. Look at the normal presentation. Look at normal presentation first. So you can see what normally how it should be. Look at the normal presentation. Sometimes you hear the maternity say they gotta rotate the baby. Got the baby in the wrong direction. Right? So the baby could get into the right direction for presentation. You see that one there with the neck, how the neck is twisted? Normally, but you see that there? Not very good. Look at forehead presentation. Forehead presentation now. You saw the head coming down, right? Normal. Now I want you to do the forehead. Just put in forehead presentation. You see the forehead? Or facial presentation? Forehead or face presentation? You have an image of the facial presentation? You guys kidding me?
Fetus is in a longitudinal line and the head enters the pelvis first. The most common phallic presentation is vertex presentation. The occiput is closest to
Normal.
That one there.
fetus is in a longitudinal line and the head enters.
Shoulder. Right?
Vertex.
You see the face presenting? All right. That's abnormal. Now look at shoulder presentation.
Doesn't look good. See?
You see shoulder presentation? All right. Question to ask. What presentation would require C-section? Let's go. What fetal presentation requires C-section? What? I said what? That's a question.
What? Normal?
I think the
What
breech.
fetal presentation would require it's a zero section.
I think I say
No
the,
thinking.
I
Let's
say
see what they have down there.
I say the breech presentation
Let's see what you have.
will require a C-section because you have to turn the baby all the way around now. That would take a lot of effort and maneuvering versus just C-section right away. And I also think the shoulder presentation might require a C-section as well.
What's a shoulder presentation?
The shoulder presentation, I said,
A shoulder.
transverse line.
Just look at the question was what presentations you require. So
I said breech. Breech.
bridge, and what's a breach?
That's when the sacrum.
You said bridge, right?
Breech. Breech. B-R-E-E-C-H. Breech.
Breach. Breach.
Presentation. That's when the sacrum is right against the.
Well, a breech presentation could have any, or the lower part of the body can be presenting. Now just remember the head is supposed to come out first. All right.
Okay.
Now, you're going to see things such as vertical, vortex, presentation. All I want you guys to know is that
The head.
head
Gotta come out fresh.
comes out first. Right? And when you have that face coming out like that can be a problem.
Placenta previa.
All right. Now stay with me. Don't let's go too far. You're right in that area. So those are the presentations, and we did mention that persons could end up with a cesarean section. So, what is a cesarean section? In your own words. You tell me
A cesarean section.
They cut in what? When they cut what? They cut your abdomen and hair, what happened?
To deliver to take the baby.
Take me through step by step. What are you guys talking about? Yeah, we could cut the belly. We could have a laparotomy. Right?
It's a surgical.
It is a surgical procedure. That what? It's a surgical delivery for baby. That's good. That's better. Look at the definition, please. Look at the definition for cesarean section. And not the common man definition. They give you the common man from Wikipedia or something.
What is a cesarean section?
Is a surgical procedure performed when vaginal deliveries that has to occur, or when the health of the mother or the baby is at risk. During this procedure, the baby is delivered through surgical incisions made in the abdomen and uterus.
There you go. So when you're cutting,
Abdomen.
you're cutting through the abdominal wall, through the uterus. You know the common man has said, the baby's in the belly. You got cut the baby out of the belly. But you know it's the uterus. That's where the baby's at. Alright? Or the fetus is at.
Or history of previous C-section.
Now, what? And that's a question now. What's the reason, the cause for it?
The
Why
reason,
do you do this here? You have read some little just now, but give me some more.
reasons for the operation include obstructed labor, twin pregnancies, high blood pressure in the mother, breech birth,
That's the presentation we just talked about.
yeah,
right?
or
Brittany?
breech presentation,
Okay. What else?
and problem with the placenta or umbilical cord.
Problem with the placenta. What problem we can talk about?
Placenta previa, placenta abruption.
That's the one, the main one, right? And what with the cord?
The cord,
You said the cord. Is there a problem with the cord?
It could probably-
What can we do then? What can you do on the cord?
it can tie around the child's
It can be wrapped around
Right.
the baby's neck. But something is important. Why do you have the cord?
to give the child oxygen
To give the child
and
oxygen.
nutrients.
And nutrients.
From who?
The
From
mother,
the mother to the baby.
From what is inside of this umbilical cord? What's in it? What's in it? What's it comprised of? What?
what's in the umbilical cord?
How many veins you have in your? How many arteries?
What's in the umbilical cord?
How many veins is in your umbilicus, and how many arteries is in your umbilicus? Hmm? And what does a vein do?
It takes away deoxygenated. No?
Let's go to see. Come on, what is it? Come on, how many veins and how many arteries?
Google it.
You Google. Google your own.
2 arteries and 1 vein. What is the function of the vein? The vein is the one that's carrying the what? Oxygen.
Oxygen away.
Not, don't say away, say there's
It's
no
not.
away.
Oh, read it, please. Read it.
The vein carries oxygen and nutrients from the placenta to the baby.
All right. Guys, remember. Let's turn it into
So
when we
the-
did the heart, the adult heart.
Yeah.
The only vein in the body that carries oxygenated blood is your
Pulmonary vein.
pulmonary vein. So what's different about something coming from the mother going into the baby? Now with the fetal circulation, please right now just look at the diagram of fetal circulation.
Fetal
Just
circulation.
look at the diagram. Just like how you look at the adult heart, look at the fetal circulation.
Fetal circulation.
You got a diagram?
No?
Has.
All right. You have the diagram. Now just read what is fetal circulation. Just read it.
Okay.
Somebody read it.
The circulation is when blood goes through the placenta, it picks up oxygen, the oxygen which blood then returned to the fetus via the dead vessel and the umbilical cord. The oxygen which blood that entered the fetus passed through the fetal liver and entered the right side of the heart.
Atrium, the left atrium.
What else?
Between
That's it?
and
It's coming from the
and
placenta, of course, right?
per minute.
Nutrients coming from the placenta. It is
But when it gets into the
rise
baby,
of the blood
it gotta go through the liver, right?
Yes.
The baby start doing its own detoxifying. And then goes to the right side of the heart. But what happens after it goes to the right side of the heart? Look at the diagram. What happens after it goes to the right side of the heart?
Right side and right to the left atrium.
How is that? What to the right side of the heart? What happens? Look at it carefully. Now you'll understand certain things as we go through here. Do you see the diagram? The blood goes to the right side of the heart. After it reaches the right side of the heart, the fetal heart, what happens?
It's going to the left atrium.
It says here that blood may bypass the pulmonary loop by moving from the right atrium through the foramen ovale to the left atrium.
It don't go to no baby lungs. The baby is breathing. Remember? That is why oxygen is being brought in by who? From the mother. So the baby don't have to breathe no oxygen. And that foramen ovale.
Yes.
That when it don't close, it's become a hole in the heart. That's how your blood shunt over, right? Stay with me in this, guys. That's why I'm telling you to look at it. I really want you to understand it. Where the blood comes from the mother, comes through one of those veins, right? One vein. Goes to there. The baby's what? Liver. Then goes to there, right at the heart. But when it goes up to the atrium, it has a little hole there in the septum called the foramen ovale. The blood passes there because normally the blood would have gone up to what? To the lungs. But the baby lungs, the baby's not breathing. Remember, he's in the most of the water, if you're breathing, you breathe water, right? You have amniotic fluid. She's not breathing. The mother's breathing for him and send the oxygen in. Are you guys with me? Look at the diagram for the foramen ovale. Look and see where the foramen ovale is at.
Foramen ovale. Foramen ovale is spelled F-O-R-A-M-E-N-O-V-A-L-E.
All right. You see, I really want to see the foramen ovale. I want you to look at the diagram with it. Okay, look at the diagram with it. Come on, Lorenz. I'm going to move you from there. Okay, what's
Foramen ovale.
right there? Look at it. Enlarge diagram. Put an enlarged diagram so you can actually see the whole. Don't just look at a little piece of thing. Take the diagram that has a whole and make it the size of your page, so you can actually see and understand that the baby don't be breathing oxygen. Everything is coming from the mother, so it bypasses. Are you guys with me? So look at the foramen ovale. Show me. Right there, right? Right. So it moves somewhere. The two between the two upper chambers of the heart.
Right here, Mr. West. Is it right here?
Right? Right, this ventricles is about there, right? Upper. So that closes. The foramen ovale closes when the baby, when he takes out that breath. That's why you got to remember, for all you mothers, you have to get the baby to cry, right? They're like, hold him by his legs
And spank him.
and give him a sharp, and that's his first breath. This is the first time he's getting air into the lungs for it to work. And so now he wouldn't have need for the foramen ovale any longer because he's not breathing, and he's not don't have to depend on his mother to give him the
Oxygen.
Are you guys understand the concept?
Yes.
So when you're doing the fetal heart rate, you're going to talk about different things. And I really want you guys to sit down and read about the fetal heart. I really want you to sit down and read about the fetal heart. Because coming out of the fetal heart, and stay with me, because we got to tie in the maternity with your peds, your neonatology and what have you. Now, we just said that the foramen ovale is supposed to close, right? When?
After the baby come out. It says 6 months to a year.
Read it, please.
The foramen ovale is a normal opening between the upper two chambers, the right atrium and the left atrium of an unborn baby's heart. The foramen ovale usually closes 6 to a year after baby birth.
Now, if it don't close within that time, we're gonna have a problem.
Mm-hmm.
Now, I want you to put down patent
Ductus
PDA. What is patent ductus arteriosus? What is PDA? Come on.
That is when it doesn't close.
Right. Look. What is a patent? Patent, we know what patent is, right? Something
Opening.
that's open.
Opening. Mm-hmm.
Ductus, that's a tube.
Mm-hmm. Arteriosus artery.
So somebody read patent ductus arteriosus, please.
I can't spell arteriosus.
Arteriosus.
Patent ovalis.
Come on, just what is it? What it is? Just read
What's
it. What
the
is
word?
patent ductus arteriosus?
Arteriosus.
Ductus arteriosus. Stop. Start back now. Come, let's go.
Start back.
Mm-hmm.
Patent ductus
Arteriosus, okay.
arteriosus is an opening between two blood vessels leading from the heart. A small PTA may cause no symptoms, but a large one may cause poor eating, failure to track, or reflux.
All right.
Reflux.
Stay with me in this. Why do you think that a person with a PDA, a patent ductus, oh, by the way, look at diagram. Look for the location of a PDA.
Mm-hmm.
Keep your minds open, guys. Are you really got? Because you're doing the fetal heart right now. Leading into the neonatology and the baby's heart and the infant heart. Can you see a diagram?
Mm-hmm.
And where is it?
It's right between the aorta and the pulmonary artery. There is a opening.
All right. Why is not a problem? They say is because the right side pressure is always higher than the left side.
Mm-hmm.
So when you move from the left to the right, it's just going to go back into the circulation, and you're not going to have any
Symptoms.
type of symptoms because the oxygen, the just oxygenated blood oxygenated again. Some going back that way while the other continue. But if we have a problem whereby the pressure on the right side becomes more
Weaker, lower.
stronger than the left side,
Right.
that's where we got a problem.
Okay.
A left to right shunt is not a big problem. The right to left shunt is the problem. And whilst we're there, don't get carried away now, don't get mixed up. We're talking about the holes in the heart, right? So we talk about foramen ovale, right? That's normal for the baby, fetus, right?
Mm-hmm.
But when it's born, within a year it's supposed to close up.
Mm-hmm.
Then we have PDA, patent ductus arteriosus, where you have an opening again.
Mm-hmm.
Now, take this other opening, because these openings that we're talking about, one is the foramen ovale is usually in the fetus, and then after the baby's born, it stays around for a couple of months, right?
Yeah.
But when you got there, patent ductus arteriosus, that's in the baby now, not in the fetus. Now I want you to look now at another hole in the heart, and we're going to go with coarctation
Of the aorta.
of the aorta. Coarctation of the aorta. And again, look at the diagram. Somebody read coarctation of the aorta, please. Anybody?
In coarctation of the aorta, blood flow is impeded through a constricted area of the aorta near the ductus arteriosus, increasing pressure behind the defects. The blood pressure is higher in the upper extremity than in the lower extremity.
All right. Coarctation. Please read up more on coarctation of the aorta. Now, finally one, I'm going to give you this because this is all with the kids. The final one for you to read up on is tetralogy of Fallot.
Fallot. I'm gonna say
Tetralogy of Fallot. Some people say Fallot's tetralogy, but it's tetralogy of Fallot. Tetralogy, T-T-T-R-A-O-L-O-G-Y. Of O-F, Fallots, F-A-L-L-O-T-S.
Oh, tetralogy of Fallot. Okay.
Some people say Fallots tetralogy. It's the same thing. Now, look please again, I really need you guys to look at the images so that you can visualize. Where all you get these holes and abnormalities in the heart. Usually pediatrics heart now we're talking about. We're not talking about myocardial infarction, CHF, and that sort of stuff. Are you guys with me?
Tetralogy of Fallot right here.
No, not that one.
Tetra, T-T-R-E.
Can't do any of this.
Tetralogy.
Which one? Coarctation?
Yeah.
Tetralogy of Fallot.
Right here. Look at it.
Somebody read what is tetralogy of Fallot, please.
Tetralogy of Fallot has 4 characteristics: a ventricular septal defect, aorta position over the ventricular defect, pulmonary stenosis, and hypertrophy of the right ventricle.
Hypertrophy of the right ventricle.
Ventricle.
Bad. Why do you think we get a hypertrophy?
You got it?
Remember, you have your 4 chambers, right?
Yeah.
Let me put it up here because the big problem
No, I can be a doctor. I
Right.
could be a teacher.
this is your septum,
I have all the information right here.
right? Your ventricles is at the bottom here. Normally, the left ventricle pushes it into the aorta. But you can get a hole at the level of the ventricles. And this is called VSD, ventricular septal defect. So when this left ventricle squeeze, it goes this way. Meaning, the blood is oxygenated, goes back over into the oxygenated, then goes back up to, not a big problem. Some people have VSDs, not a big problem. But then when you're having pulmonary stenosis, it now means that if this, the pulmonary, remember this coming from the ventricle, it is going up here, right? Pulmonary arteries. And if you have some stenosis, it means that it's going to increase the what?
Pressure.
The pressure in here. So if it increase, because it got to try to push beyond this. And because it's trying to push beyond that, this right side that is normally just pushing up to the lungs has to work harder. And because it will work harder, the muscles is going to get stronger,
bigger, more muscular.
so it becomes hypertrophy. And when that happens, the pressure in here now increases. And instead of it going from a left to right shunt, you have now a right to left shunt. So what that means? Impure blood is going on to your and that's
Circulation.
going around the body. So that's what your tetralogy follows. Are you guys with me? Please, that takes the time. Look at some short videos, right? Then read. Don't just go start reading. Look at the short video. Don't go with no 5 and 10 minute video. Do a little 2 minute video. Then read. These are all problems with, as we say, holes in the heart. All that we talk about is holes in the heart. Things that usually happen from birth, not things that happen later. All right?
So always be considered heart.
And you get heart murmurs, can lead to heart murmurs.
What are the symptoms?
All right? So, different symptoms. Think about it. You do your critical thinking now. If you haven't tetralogy of Fallot and you find that the blood supply, which is supposed to be oxygenated, is now having a lot of what? Carbon dioxide and impurities in it. What do you think is going to happen?
You will not have enough oxygen
You're
over
going to
the
be
body.
very tired, fatigued. It's going to show up with discoloration.
Cyanosis.
Right? All that nice stuff.
Not
You
so
guys with
nice.
me?
Not so nice.
All right, let's slow down. Let's stop here for a moment. Take a deep breath. As I know if we talk about something, I'm just trying to keep it in and not get too mixed up. We start talking about there the fetal heart, right?
Yes.
Because you want to know what their umbilicus does. And we said that you have one vein and 2 arteries in there, and the vein bringing their blood supply. And for you guys to understand the whole concept, is that the baby's lungs don't be working. Because the baby's in what? In fluids. And they'll be breathing fluid and they're going to die. So there's no breathing. So who breathes to the baby?
There's mother.
Mother. Right. But the same process still happens where when blood comes in, it got to go to what? The liver. Remember when you eat? It got to go to the liver. The liver now what? Detoxifies and then send it back up to the heart, right?
Yes.
Same thing. But this time, it goes through there, foramen valley. It don't go up to the lungs.
Okay.
Right? Bypasses
the lungs.
And then we go on to all these other things that can happen. All these different PDAs and VSDs and Fallots and all that sort of nice stuff. Any questions?
Tomorrow, I'll have questions tomorrow.
Guys, I'm sorry, I'm sounding like a
Broken record?
red broken record.
I know.
Same thing all the time I'm saying, but you have to read. You definitely have to read. There's a lot of reading. And things that you don't understand, I want you to ask me questions. So we can do the explanation. I want you to understand what you're doing.
That's right.
Don't want to go try cramming and trying to memorize. Don't do that. Don't do that. Try to understand. So, however they send the questions to you, you'll understand it.
Should we also
Right.
look up ventricular septal defect?
That's VSD. We just start with VSD.
Oh, I
The
saw
shunting.
4. I saw 4 here.
That's where the Fallot's tetralogy Fallot's is 4.
Patent ductal arteriosus. We talked about that one too, yeah. Yeah, we talked about that one too. It's 4. Right.
You guys see how important, and just look at it. Oxygen is responsible for everything in your body, right?
Yep.
Yes, definitely.
And any problem we get is because something get blocked up. That prevent the oxygen from going where it's supposed
That's
to go.
right.
Same thing with nutrients, something block it up. So blockages is a big thing. And we see it in today's world,
Septal.
everybody's going to take a clean out. Because the thing they get blocked up. But a clean out is a different type of thing. That's with the GI system.
Ventricular septal defect.
I'll give you guys 1 more minute to just let us filter on your head, see anything you don't understand, think about it, and then throw it back at me and we'll talk about it. Oh yeah, if you gotta do the bathroom thing, go do the bathroom thing. Anybody in this room never went to Florida?
I've never been to Florida
You
before.
never been to Florida?
IKEA.
That's what I
Hey,
said.
You
Lord.
said Iki. You said Iki.
But IKEA. Your name don't have an A at the end of it.
Is the pronunciation.
Right.
IKEA.
Unless
What
people
is the
pronounce it based on how English is done.
Yeah, IKEA.
So when you correct people, it's good. You let them know the correct way of how to enunciate your name. That's a good thing. But people who see it for the first time is going to say key.
Yeah, that's true.
Yeah.
That's still the wrong pronunciation.
It's a key.
IKEA.
That's when we got the A behind something that's usually feminine, by the way. You know it.
Mm-hmm.
Like a
Yes.
D, no?
IKEA. IKEA.
Carlotta.
Call long.
Alright, so that's the last one. Then patent ductus arteriosus. Don't worry, guys. I'm gonna send everything to WhatsApp. Just look in your WhatsApp. I'm gonna send you all the videos and everything.
You're the best.
Alright? I got you. Doing that right now, actually.
IKEA.
I can do more studies after you look at the introductions. Arteriosus. This is interesting. Nice little intro. 1 minute video.
All right, quickly. So we touched on, since we started looking at the test. So you did, yes, we reached to number 2, right? And then based on questions were being asked, we start to go into different areas, such as, what areas did we go into? What areas did we look at? Yeah, it's somehow short-term memory, son. What did we look at before you reached down there?
No.
Before we start talking about the pediatric heart and the fetal heart, what did we talk about?
The
We
stages
start
of
off with
labor.
gravity and parity, that's what we start off with.
Yeah.
And then we move into what?
To the different presentation of the baby.
We did presentations. After that, before that. Before we talk about pregnancies, we did presentations. We talk about uterine contractions, right? We talk about Pitocin dress. We talk about the organ retrans too.
Section.
Reason for the C-section. Talk about something, you know. So those are the things I want you guys, whenever you do things, is just go back. Go back. Even when you're studying home by yourself, always go back. One of the best ways to do things is to read it or look at a film or something, and then go sleep.
Go to sleep.
Then you get up, and then you go back and see how much you remember.
I could do that.
That's how you normally.
I love sleeping.
Right? You read and you look at your films and you all have you, then you go and sleep. And then you wake up, and then you try to see all that you remember.
I always sleep when I
And
sleep.
you're gonna find that these things that you, when you do that way, more remains with you. Because you kind of pretty much try to understand what you're all about. Okay? Don't try fighting it all the time like that. The moment you reach a point where it's bothering you, don't fight it. Don't fight it. Go lie down. Relax. And sometimes even before you go back and look at the book, it comes to you. There are many times you may not remember something, and you're like, damn, and you keep mixing up a word with another word. And it's not coming to you. And then you just forget it.
Just leave it alone.
And then all of a sudden it just
Bring it to
comes right
it's
back.
on right there. That's true.
Ventricular septal defect.
All right, so we said that we were number 2, but let me go to, because we were talking about the conception. We said with conception you get gestation, right? From the time the person gets pregnant, we talk also about the time factors. All right, so seeing that we talk about the time factor, and you know the blastocysts form, and you get the trophoblast, which becomes the placenta.
That's the same thing.
Now, I asked how you know a person is pregnant. Most everybody was saying HCG, right? Human gonadotrophin. You look in the urine, and I said, because it maintains a pregnancy, you look for it. Now, on the same question, how you know you're pregnant, apart from that test, what else you can do? Or what else you could teach a patient or a woman, which is community teacher? You're at the church and you want to talk to the ladies in the church and what have you. So, you want to talk to the ladies in the church who could get pregnant. You don't want to talk to the ladies who passed that age, right? So before a woman gets pregnant, do you think that she should still be seeing her menses?
Before she gets pregnant?
What?
Then if the period, that's when we go back. So the last time we had it.
So a woman should be ovulating still. That's what we're saying, right?
Yes.
If she's not ovulating, then why she's not going to get pregnant?
There's no eggs. The egg is no egg.
No eggs are being produced on the uteruses. Now, when we're doing gynecology, remember gynecology is female problems, right? Obstetrics is with the babies. Right? And you find the woman is having fibroids. And the fibroids can cause her to bleed a lot. It can also cause the abdomen to look swollen. Based on the age of a person, some doctors may suggest why not have a hysterectomy, right? Because when you remove the fibroid, it can come back. Why is it that some women don't want to have hysterectomy? Why do you think they don't want to have hysterectomy?
They're afraid they're not going to be able to have babies no more.
Right? They want to have a baby.
Yeah.
Right? Anything else?
It's for that. They want to get pregnant.
Right, but the woman can't get pregnant because she's no longer ovulating. So why is it the problem? When she said, you know what, you're getting fibroids, you might as well just take this thing out. And she's like, hell no, don't take it out. Why do you think you're being one of our reasons for not wanting it out? The what? Gabrielle, speak, we can hear now. You're hiding behind the vent there. You see, I tell you, she's just hiding behind it. What is it you say? Come on, we're going to share. Let's see here.
Sensation, right? I mean, she don't have no more period.
She's not producing estrogen.
Why not have a hysterectomy? All right, as you know that a lot of times, and this is where you come into psychology, is that women believe that if their uterus is taken out, they're no longer a woman.
Yeah.
Right? They feel that they've taken out what made them to be a woman. So they don't want to have that taken out. So what conversations would you put up to her that convince her, or try to convince her, or no, I won't say convince, that's a strong term, but to make her understand the rationale for having the hysterectomy? What is it you think you should be talking to her about?
Yeah, number one. She's bleeding.
So with the fibroid, it's still bleeding?
Why with the fibroid is still yet? Without the fibroid, with the fibroid she bleed. So you want to tell her that all that uncomfortable thing, pain and what have you that you go through every month will stop. And your social life
Will be better.
especially if you're Muslim, you can't go wrong your husband at that time of the month, right? So when it's bleeding, that's going to be a big problem. So, getting rid of it, so what it was. I tell you guys have very cute hearing, you know. She will not have that problem in that she had been having, and you know, she wouldn't have to buy any more what?
Pads.
She don't have to tell her other half, not
touch
tonight.
me, not tonight.
Every night is every night, or every day. So you have a lot of pluses with it.
No more cramps, no more pain. I get a lot of pain.
But when persons just, and why I'm saying this, guys, is one, hysterectomy can be done through the vagina.
Yeah.
And then you have cesarean section, and you have different types of cesarean section because of people looking at this body image disturbance. They don't want scars in the abdomen. They want to wear two-piece bathing suit when they go to what?
The beach.
To the beach. So they have the bikini line, right? Instead of before it was a transverse, and people see a lot of people got this long. That's what they used to do before. You see the older ladies have this straight down like that.
Just put a tattoo.
That
Cover it up with a tattoo.
the what?
I think the best thing to do is cover the scar up with a tattoo. Good to go.
I think today when they do it, you don't even know, you can't see, you don't really see that thing.
It's all when the bottom, they can do bikini cut. You don't see the scar.
Just for your information, one young lady,
Yeah, I see.
some years ago, she did her own, that's why I was asking you guys, you know what cesarean section is. She did her own cesarean section.
How?
She lie down in her own house, get a knife, and cut,
So she has a
stitch,
mirror?
and do everything herself.
Huh?
Yes.
She may be ex-military.
She arrested.
She may be ex-military.
But it was weird, she had to, you know, but imagine you cutting your own belly.
Was she a medical student?
You guys can look it up on the internet when you have time.
That sound like a fiction.
Section in herself.
That sounds fictional.
Think of it. For persons who are not diabetics, if you tell that person, I want you to give yourself an injection, they're like, who? Me? I'm sticking myself. Well, diabetics, you do what? 1, 2, 3?
On a regular.
Got no problem with it, right?
Yeah.
When we get accustomed to certain things and we get beyond it. Now, how do we know now, apart from doing the urine test, what else can we determine when a person is pregnant? Lab work. Like what lab work?
Blood work. Blood test. You get to do blood test for you to see if you're really pregnant.
Some people only see it in the blood.
What is seen in the blood?
The pregnancy. Back in the day, they just look at you.
You look for HCG in the blood. When you guys just check and put the little thing inside of the urine, I'm going to tell you. So what nagels or nagels?
Talking about a fern test? No, the fern test. Never mind.
Put nagels, please. N-A-G-L-E.
Nagels.
Basically, you teach the person.
Nagels.
What is the first day of your last menstrual period? Then you take out 3 months, go back 3 months.
Test.
And then you add 7. And that'll be the expected day of what? Delivery of your baby. Look at nagels, please. N-A-G-L-E.
N-A-G-E-L-E. No.
It's N-A-G-E-L, it's N-A-G-L-E.
No, the first, no, I don't know. Can't find it.
What you looking for?
Nago.
Nego?
N-A-G-L-E.
N-A-G-L-A.
Oh, G-L-E?
N-A-G-L-E.
Okay.
I ain't gonna tell.
I still got nothing. I got
Nigga
bagels.
what?
I got bagels.
Nego? Or beagle?
Measure estimation of birth. Put that in to make it specific. Estimation, estimating birth date.
NATO. Estimation.
Paul Nago is an Irish co-driver.
Really?
Oh, I got something.
N-A-G-L.
Oh, N-A-E.
N-A-E.
E. Okay.
N-A-E.
N-A-E-G-E-L.
Nagels. N-A-G-E-L-E. Put N-A, put N-A-G-E-L-E.
Nego definition of
All right. Just put N-A-G-E-L-E.
E-L-E.
Put N-A-G-E-L-E. See what comes up.
N-A-G-E-L-E.
Put N-A-G.
Nothing come up.
N-A-G-E-L-E.
It's just something for the person.
N-A-E. Okay. Ah, come on. Stupid thing.
just do it like that. Estimation of what, Mr. West?
Estimation of birth. The due date for the baby. N-A-G-E-L-E.
Estimation. The rule estimate the expected date of delivery. Oh, it's approximately S.
Okay.
Yeah, I see it now.
A-E-G-L-E. Right?
Yeah.
So what that you do for the first day of your last menstrual period, you take out 3 months. So when you do that, now you just add 7 to that, and that will be your due date.
Yesterday, date of delivery from the first day of the woman's last menstrual period by adding a year, subtracting 3 months, and adding 7 days.
Menses started
Coming up.
on the 7th and run for a couple of days.
Just look for Nagel's estimation of
3 months
birth.
back.
Let me see.
So the 7th of July,
Try it.
go to the 7th of what? June, 7th of May, and 7th of April. And then you add 7, so that was the 14th. So it'll be the 14th of April will be the due date.
I thought they did.
Right?
It says, from the first day of the woman's last menstrual period,
There's the part that says 45.
add a year, subtract 3 months, add 7 days. 1 year minus 3 months plus 7 days.
So if your last
1 year, that's mean
May,
97 days.
let's say the 10th of May,
If your last menstrual period was the 4th of June, you add 1 year to that. Okay?
That's 1
Add
year.
July, August, September, October, November, December, January, February, March, April, May, June. That would be June of next year. Now you minus 3 months, right? So that's January, February, March, April, May, okay, January, February. So that'll be February, right? February 4th. Now, we're gonna add 7 days. 7 plus 4 is what?
11.
That'll be January 11th.
That I'm giving birth
Simple.
for you?
all right.
How they
That's just a
say?
due date.
What
Let's say that,
1
why
year,
would you want to know the due date?
12
So you
months.
can know.
Add a year, minus 3 months, add
Have
7
a baby
days.
shower.
Yeah.
Why you want to know the due date?
So you could have a baby shower, Mr. West.
So you can have a baby shower.
Yes.
So you can make sure to get your gifts.
Hell yeah.
And your-
Hello?
A lot of diapers.
7 days.
But
Plus 7 days.
knowing that is very important, because remember, we just
that's
talked
me.
about preterm,
That's in Nagel's room.
normal, and they have postpartum.
Nagel's,
We've
Nigel,
gone over the starting weeks.
Nigel,
Nagel's.
Nigel room, Nigel.
So you want to be, despite the fact that some women have PV bleeding when they're pregnant. They have some bleeding, but it's not necessarily coming from their uterus. Okay? Not necessarily coming from the uterus.
Where it's come from?
Could be in the vaginal canal,
Mm-hmm.
but not necessarily coming from the uterus. You could have some bleeding too, can be coming from the placental lining too. But it's not going to be where it is being shed. The thing is, when the lining is being shed, because remember, you have the estrogen, which helps the thicken. And then when the egg, the blastocyst get implanted, you have the progesterone now joining. And then you get the HCG joining, all them joining to what? Keep that pregnancy. So you don't know. So when you start to see like a portion spotting, now you really need to go see a doctor to see where is it this bleeding coming from. And you're gonna look for your blood pressure. Because at that time, a person could have problems with the blood pressure and the proteins.
Okay.
And especially with the blood pressures, it could put them into seizures. They become a high risk.
For seizure.
And it's called, look for preeclampsia. Look for eclampsia and preeclampsia.
Preeclampsia.
Take that off.
Look for eclampsia and
Hurry up,
preeclampsia.
stop worrying.
Potentially dangerous pregnancy
Don't rush me.
complication characterized by high
I'll get it
blood
done. Don't worry. I'll get it done.
Some guys, this is not just ordinary discussion though. You guys gotta stay with me.
Preeclampsia is.
Let's see. Yeah, my triple.
Hold on. Let me read.
Yeah, yeah.
That's not a good definition. Come on, no, that's not a good definition. That's not a good definition. Preeclampsia. Preeclampsia is a condition in which hypertension develops after 20 weeks of gestation in a woman with previously normal blood pressure. Continue.
Yes.
In addition to hypertension, renal involvement may cause protein in urea.
All right. So I just tell you guys, two things you look for: high blood pressure, proteins. Proteins in there, urine. Why you gonna look for because proteins are not supposed to be in your
In the urine.
It means now that your glomerulus, that's filtered, you're having some problems with your Bowman's capsule. And these larger molecules are escaping into the urine. That's the problem. High blood pressure. Person never had pressure before. Now they're having blood pressure. Now just look for the word eclampsia. Not pre, just look for eclampsia.
Eclampsia.
A condition in which one or more convulsions occur in a pregnant woman suffering from high blood pressure, often followed by coma.
Okay, eclampsia is bad.
And
Person having high blood pressure, they could end up with seizures.
yes,
And these seizures can put them into a coma. Don't mix up preeclampsia with eclampsia, all right? Are you guys with me? All right, don't tell me y'all with me, y'all not with me. You
Eclampsia
know.
is the occurrence in a woman with preeclampsia
Or
or
else they're going to
seizure
sign for
that
divorce.
cannot be
sometimes,
attributed to her.
Mr. West, I used to see they put things in the people mouth because sometimes when they have a seizure.
We don't put anything in anybody's mouth.
No, I
any
just
longer.
tell you, it's
That's
not
back
over
in
here.
the days. They used
That's
to
back
call
in
it
the
a bite
days.
stick.
Yes.
Don't put bite stick in anybody's mouth any longer. All right? That's old school.
It also says here that eclampsia happens to patients with preeclampsia, correct?
Of course, preeclampsia.
Of course,
Leads to
preeclampsia and
eclampsia.
eclampsia.
Okay.
Because you have the high blood pressure and proteins. The high blood pressure is a big problem. Guys, stay with me. Remember, high blood pressure causes damages.
Yes.
High blood pressure causes what? Vascular dementia. Make you go crazy, right? High blood pressure mess up your kidneys, put you on dialysis. High blood pressure causes your heart to have myocardial infarction. It does a lot of crap to the body. It messes up your eyes. You just name it, it messes up.
So which one is worse, high blood pressure or
And
diabetes?
sugar.
Both
Both of
None
them.
of them is good.
They're the same thing.
Both of
There's
them.
something like the
Close.
triad.
Close.
Triad of diseases. Just put the word triad, please.
Try
Just the word
hard.
triad. T-R-I-A-D. See what you got. Triad.
Beck's triad. Oh, I see something here. Triad, chest pain.
He said just the center.
Justice Center.
What else? That's all? T-R-I. T-R-I.
T-R-I-A-D.
Triad.
E-D, right?
Triad.
AD, of course. I see hearing loss, vertigo, and tinnitus now. Triad. Maybe we can search more specifically. Maybe.
Let's see again.
Triad alone gives you many things.
Yes.
You
Triad
back-
preeclampsia.
So read it for them, please.
So the classic triad of preeclampsia is hypertension, proteinuria, and edema. Today, edema is no longer considered an important part of
The triad is always three. Try, three.
Mm-hmm.
All right? So it's preeclampsia, eclampsia used to be said before, with the hypertension, the proteinuria, and edema.
Mm-hmm.
But like you're saying, the edema is out. They kind of focus more on the high blood pressure, like I told you guys before, and the
Proteinuria.
proteinuria. All right, that's where the focus is on. But that's what's being called a triad. All right.
The three is blood pressure.
Just take a minute to let that settle in. So these things, what we just spoke about there, preeclampsia, eclampsia, this is all happened to the woman who's pregnant, right?
Yeah.
Guys, stay with me, right? And understand again time frames.
Mm-hmm.
Look at time frames. When you do maternity nursing, look at time frames. Now, we said that a woman can get pregnant, but the baby develops in this fallopian tube. And when this happens, it is known as ectopic pregnancy. What would be the complications of ectopic pregnancy?
Bleeding.
What would be the complications? Not those are manifestations. What would be the complications of ectopic pregnancy? Come on, guys, critical thinking. That should jump out at you right away.
Infection?
No. Pain. That's manifestation. Difficult delivery.
There you
Internal
go.
bleeding.
Your
Delivery.
fallopian tube is just a tube. And if something is growing in it, it's gonna burst open. Mhm. Come on, guys. Come on. Stay with it. Stay
Critical
with it,
thinking.
please. And which part of the fallopian tube we said?
Yes, miss?
Ampulla.
Ampulla?
Yeah,
Okay, that's
One
one,
of the
yeah.
things, and why do you get, guys, stay with me, please, because this is, we're not be going over this. We got lots of other things to go through before you leave. Not today, but before the end of next month. Too much to go through. So the ampulla area, what can cause ectopic pregnancy? We all know that it's because the egg get fertilized and start to develop in that. But why?
Because implanted in there.
Infections can cause.
Go again.
As an infection can cause it.
How?
We have some more like the celiac. The hairy thing that inside the tube that they like having problem with them, the infection will be destroy those.
When you're having problems and where that nice smooth area that moves it along, pushes it along, you'll have it becoming rough and the thing can't move the way it should be moving. So that is the reason why. Usually when you get something called PID. Now what is PID?
Pregnancy-induced
Pelvic inflammatory disease. So when you find you're having, especially women who get sexually transmitted diseases. Because most times they're having gonorrhea, they don't know. So the microorganisms go up into the fallopian tube. And when you get to the fallopian tube, infection is known as what? Just a tube. What is the infection called? All right. Say again?
Yeah, the conversation is that it's
All right, the name is salpingitis.
yeah.
Look it up, please. Salpingitis. Your fallopian tube that has an infection is a salpingitis.
Salpingitis.
P-I-N-G-I-T-I-S. Do you guys see it? So you hear a lot of times women say the trouble with the tubes.
It's the inflammation of the tube, of a tube.
And stay with me, guys. A lot of time women have sex with men who are not circumcised. And because they're not circumcised, under the skin you have something called smegma. Smegma is a nice big set of bacteria. So when the man has sex with the woman, the bacteria now goes into the woman and travels up into the tube. And that's why you end up with salpingitis. That's why in Muslim countries and Jewish countries where they practice, the incidence of salpingitis is low. Very low. Because they ritually they have to do
Wiping themselves.
Circumcision.
So that's smegma. Look up the word smegma.
That's like a
S-M-E-G-M-A.
cheesy thing.
S-M-E-G.
S-M-E-G-A.
M-A.
It's
E-G-M-A.
Somebody read it, please.
Smegma. It's a cheese-like sebaceous substance that is collected under the foreskin and is easily removed with basic hygiene.
That same thing you call cheese.
Big white cheese.
You guys laugh, it's a serious business. Because as you know, I always tell persons, and you're doing, you guys look. And as nurses, you got to know, right now, there has been a great increase in gonorrhea that cannot be cured. Meaning you have resistance. They're resistant to their antibiotics. Guys, just be careful, and when you're teaching people, teach them. I always tell people, even if you know that, if you, for instance, if you are going to go to bed with somebody for the first time,
Turn the light on.
keep the lights on. Get the penis and squeeze the penis.
Yes.
Play with it.
What
No,
we
that's
play
not. You want to play with it for what? We call
Assessments.
no, foreplay.
Squeeze it, yes.
Foreplay.
Assessment
But when the
test.
person
Not
think
bad.
you're doing foreplay, you're checking them out.
Yes, you
And
squeeze it.
if you, when you squeeze it, you see anything come
Anything
out.
come up, that's made the person
And it's
infected.
whitish, or if it's smelling,
Infected.
and you see cheese,
That's not
then you're gonna say, I didn't bring no bread today.
that's no cottage cheese.
So that's it. You might get beat up or something, but
At least you didn't die.
At least you safe.
It also says smegma is present between labia as well.
absolutely, absolutely. And the same thing with men. When you go there,
What is it?
tell them you want to admire it.
Yes.
And you want to look at it.
Do your art pie.
You want to see the Mount Venus. You want to look everything.
Do your art pie.
And if you see any white stuff,
You didn't bring bread.
you didn't bring bread for them. You don't bring bread for that one. You didn't walk with a spoon.
Oh, you have the spoon.
Oh Lord, man, let me stop, right? But seriously, when you're teaching in communities, you have to give the basic thing: look, smell. That's where you do olfaction, smelling. Inspection, you're looking. Palpation,
Touching.
play with it.
Assessment skills.
And those are your assessment. You're not going to do percussion, but at least you do 3 of the 4, of the 5 actually. You're not going to do percussion auscultation because you're going to put on a stethoscope and tell them. Oh Lord, have mercy. But seriously now, and not only that, guys, do remember that, and stay with me in this place, women who have sexually transmitted disease, such as herpes simplex type 2, herpes simplex type 2, they will not have vaginal delivery. They're going to have C-section. Right? Because it can affect the baby. Yeah. And a lot of people have this infection, but hey, just got to tell them when, you know, once if the woman says she had this problem, you got to do C-section. And that's with people with the STDs. And once a woman had C-section, usually the next baby will also be C-section. Right. Women who are too fat, women who are pleasingly plump, they gotta have C-section. Women who have problems with it, remember we did the pelvic girdle, the android and the platypaloid shapes, C-section. When a baby is having, when the baby for come out, it have something called CPD. You know what CPD is? CPD, put this down, guys. CPD is cephalic pelvic disproportion. Cephalic pelvic disproportion.
Cephalic pelvic disproportion.
Pelvis for the birth canal. Please look it up right now.
Cephalic, you said?
Cephalic, CPD, cephalic pelvic. Cephalic is a baby's head.
Yes, his head. Anytime
Pelvic is a woman's pelvic. Disproportion mean interfitting. Guys, look it up, please. Somebody read CPD, please.
Is a condition where the baby has trouble getting through the birth canal because of the size of the baby's head. The baby's position on the side or shape of the mother's pelvis.
All right, guys. That you can go on, but that's basically we talk about, right? When we talk about the woman's shape of her hips can cause her not to be able to deliver the baby, or the baby might have a big head. They're not going to come down there. All right, so please put down CPD, read up more on it. Years ago, they used to do something called forceps delivery. So especially for these children, they used to do forceps delivery. And of course with that can cause things such as cerebral palsy. So just put on forceps delivery, and I want you to, because I don't think they do, but let's see. Look at forceps delivery, and then look at an image. Forceps.
Oh yes, they take them with forceps. They put their hands, they just put the thing.
Yeah? That looks scary.
Look.
No, they grab them.
Look.
Like they have a thing like they grab
This is what they used to do
the baby out.
back in the day.
What fun is that?
So we've gone a far way, huh?
Sure.
Imagine the doctors used to put that thing
And hope.
and hold on to that poor baby head
And then
and
it's
pull the
a
baby
iron.
out.
It's a iron.
That's not nice.
Look.
How,
You see
you
what
see how?
they used
And
to
that was considered to be normal. And I'm not talking about very long time ago either.
No, it's back not too long.
Within your time, forceps delivery will still be practiced.
Yes.
Sometimes that thing can mess up the baby.
You don't
Yeah,
see it.
sometimes it can mess
Of
up
course,
the
you can
baby.
damage a baby's cranium.
Mm.
It's too hard.
Oh
On the
no,
poor
back
baby
in the
head.
days, you used to say that's a good thing.
Not too long.
Midwives, you need to learn how to do it.
Sometimes it depends on the cause of the vagina, childbirth, the forceps delivery, the healthcare provider, forceps, and then any transmission. Like you have a large home, that was in the home, and the baby has no sign, that's kind of, Jesus. Thank God I'm not having no more kids.
What do you mean? Only
I'm
25.
off
What do you mean? I have more kids? I love you too. I love you
What
too.
how old is she?
Shut up.
What you say?
She told you 25? She has a 19-year-old baby.
My dash.
How
I'm
come?
telling you, her mouth.
No. You told him you 25?
I never told him I was 25, so mind your business. Thank you.
You know that song?
Uh-huh.
That's why I said,
Let me help her do that.
I want to go home and sleep. I'm tired.
Me too.
Tired.
You work tomorrow?
I'm supposed to, but I should be off tomorrow.
All right, let me just close off with these risks for now for tonight. Let's look at some maternal risk factors. Maternal risk factors. The first one is genetics. Meaning that something is passed down by chromosomes. Right? I remember when you do your
Amniocentesis.
That's why you check it for the chromosomes and what happens, right? And this could actually tell you whether a child can be born with certain problems. So genetics, risk factor, 1. Then you want to talk about, believe it or not, abuse and violence. Some men will abuse a woman, right? And abuse is not just physical abuse, like punching and kicking and slapping, but mentally causing that woman to become very what? Anxious, so of anxiety, right? That's abuse. Violence now is when you're going to actually have somebody hitting and beating
Hitting
up
you.
on somebody.
Oh, yes,
And unfortunately,
you're gonna send me.
in certain societies, once a man knows the woman is pregnant, you don't want the short to have a pregnant to do what? You punch her in her belly. Right? You punch her in her belly. And why you punch her in her belly? Because you can't
You have it
see. You can't go and tell the police.
Huh?
Here they can, I guess, do
Exactly.
things. But back home, you punch in the belly,
That's weird, yeah.
can't really see marks of violence.
That's interesting.
Right?
Oh my
Punch.
God.
And that, of course, will disrupt pregnancy.
I don't know why it's like that.
Punch, kicks, whatever they do, knees, whatever. Or some women will fight with other women. Like a woman here, that woman is pregnant for her husband or her boyfriend. When she go and fight with the other woman, her intention is to
Punch the baby.
knock it out.
So
Back in my days when two women fight, it was not about the baby. It's about shaming the other woman. They will strip each other. And of course that was a good show.
Oh, really?
I'm serious. Back in the days, when two women fight, all the one goes rip down the clothes and leave them naked in the street to avoid embarrassment.
Huh?
That was all about. Fight to be naked. And guys, don't stop them. Let them fight. Don't. Let them fight. Thank God for America.
Amen.
If you got one just a little blood coming from your mouth,
911.
the cop's gonna write it down. It's violence.
You heard that?
You heard this guy who's with suing for $50 million. The guy from Pirates of the Caribbean, man.
Johnny Depp.
Right. She's come to sue him for 100 million. Them people got money here. And the thing is, she's saying that she abused him. She would slap him and call him names and that sort of stuff. Boy, she should be down in the Caribbean. She slapped your mom.
That's it.
You want your phone?
Oh Lord have
Thank you,
mercy.
baby.
She should
Everything.
get it. Oh Lord. All right. Then
I think she
the
removed
use
the charger.
of nicotine. What nicotine does?
That's the problem.
Damage the liver.
It causes spasms of the blood vessels. So nicotine, substance abuse, alcohol, all that should be avoided. And why? Why do you think it should be avoided? Give me a rationale. How is it going to harm the baby?
Development.
Low blood
How?
Mental. It causes the blood-brain barrier.
You're on the right track. It crosses the placental barrier.
Okay.
The placenta protects the baby, but nicotine, alcohol crosses the placental barrier and hurts the fetus. And whilst you're there, remember your pregnancy is divided into 3 parts. First trimester, second trimester, and third trimester pregnancy.
So it was 4 parts.
Where you get that full from?
Trimesters.
Oh yes.
First trimester, second trimester, and third, and all 4 trimesters. All right.
Or phases.
We just talk about it. Sexually transmitted diseases. It's passed to the baby, such as examples: HIV, herpes, syphilis, chlamydia or chlamydia, and gonorrhea. The one we just talked about? Gonorrhea is becoming more prevalent in New York, guys. I'm very serious now, and most times women don't know they have it. Okay? Most times women don't know they have it. 95% of women that have gonorrhea, they don't know. There's no signs and symptoms until something happens later on, like PID or something. Or you have a new boyfriend, and the boyfriend complaining of discharge.
Can you say that again?
See which part?
The list: HIV, chlamydia, syphilis, gonorrhea.
Chlamydia?
Chlamydia.
Yes.
Sexually transmitted diseases.
Yes.
Come on, your STDs. Right?
HIV, chlamydia, herpes.
Guys,
Herpes, thank you.
we know that people engage in things such as anal intercourse. Please ensure, I'm not talking about you, because remember, you're not talking about no personal now. But when you engage in, when you're teaching about anal intercourse, you don't tell a person they should not have it. What you're going to tell a person is that
Use protection.
once the person put the penis in the anus and
Don't-
they take it out,
Don't put it
it
back in the
should not be
vagina.
going into the vagina. Because it's taking the microorganisms that from there
Introducing it to
and puts
the
it
right.
into that area there.
Mm-hmm.
But when you're in the height of sexual excitement,
You don't know what you're doing anymore.
finger go in, finger come out, finger all over the place. But that's what it is.
Let me go home.
Mr. Lawrence, I don't hear you in the class, but we talking about this and you were very loud. Person who have mental illness. Remember that mental illness usually come under two headings, neuroses and
Psychosis.
So if the patient has mental illness, then they are very high risk for getting postpartum psychosis
Psychosis.
or postpartum
Blues.
depressions. Okay? Guys, put these down. I want to read. I don't want you guys to be want to read. I give you guys explanations. Alright, what else do we have? Cardiac problems. Blood volume increases. Right? Your hypertension and all that sort of nice stuff. But what I want, I know that you, this information is on your computers, but I want you to understand the rationale. Don't just say sexually transmitted disease or high blood pressure. How it affects. That's what I want to hear from you guys. How it happens. You know, why. Okay? And I think that's some of the problem we have in the class. Because people just reading, alcohol is a problem.
How?
But how?
How?
Why?
Why?
What does alcohol do to make it a problem?
Make you drunk. You don't know what you're
That's
doing.
where the concern I have. Because everything we talked about, everything I'm talking to you about and read to you here, you get it all on the internet. Everything. And lots more. But what you don't get is a rationale, the explanation. Alright guys, stay with me. So a patient who has diabetes, patients underweight or overweight, patient with thyroid gland problems, a patient who's too young, under the age of 20, and a person under the age of 20 leads to preeclampsia. And for advanced age, at one time they used to say anything body over 32, gotta be careful. Now women getting 40, 45, and they're getting babies. And 50s. Times have changed. Times have changed, you know. The new 40 is what, 30 now, right? So So you guys can still party.
Yeah, not having babies.
So when you guys are going down to Florida, only mini dresses and only
Booty
what?
popping.
Sundresses.
Okay, I'm
What
going.
sundress?
I'm
Need
going.
a tin something,
I
right?
changed my mind. I'm going.
I
I'm going.
don't know. I'm not a woman. I'm a man.
I wasn't. I don't know. I wasn't thinking
sundress?
clearly. Now I'm thinking clearly.
What sundress is there?
Booty popping.
She talked to that before I go. What
So
sundress is
because I
that?
said booty popping. See through.
Oh, you can see through.
It's a see-through dress.
Oh. Okay. Now I get it.
Oh, light.
You mean tight clothing?
It's not tight, but you can see the shape because it's light.
Oh, it's shapely. Okay.
Guys, remember you come with your husbands, right? That's all I say. You come with your husbands. And your other part.
You don't bring sun to the beach.
Again. Because the sun is already there.
The sun is already there.
You bring your husbands and your.
Boyfriend.
You know, when I've been to a couple of these graduations here in New York, and I'm introduced to other halves by students, and I'll be laughing on the inside. Why is I laughing on the inside? Because in classroom, people's like, this I do this. Oh, you should say. You see when the husbands are up.
They're nice and quiet. Not that one.
Very mellow,
Polite.
respectful they are. All that in class.
Confirm.
This and that and oh, he can't do what? I'm the one who ruled. Rule what? The husband is there. They just, I just say, man is up. Don't talk a lot. I know, boy. Anyway, and poverty, of course, we talk about the socio-economic situations, people who cannot afford.
Whose computer is this?
All right?
Oh.
It's very important to look at socio-economic.
I think it's
And,
Oh, he put his
guys,
computer here. What's wrong with it?
I did not have an opportunity to go over all with you guys that you did. As I've said before, the opening, I only hope that what we did yesterday was a learning experience. And you understand why we go that way and what to